Medical Freedom Amendment 28 proposed to the United States Constitution as the 28th Amendment, a crash course in the necessity of now is the time. We are experiencing medical oppression, medical censorship, medical discrimination, and medical abuse of unprecedented scope, with no accountability or responsibility on the part of the oppressors, censors, and abusers. This state of affairs has continued for too long, has become intolerable, and must end now. The Medical Freedom Amendment secures our inalienable rights and body autonomy. It is far-reaching and must be added to the United States Constitution to protect us and future generations. It reads as follows: all people have the right to secure their health in the manner they choose. Congress, the President, state legislatures and executives, governmental agencies or departments shall make no law, rule, regulation, countermeasure, executive, or emergency order that impedes the individual's rights to informed consent, nor right to medical choice, nor freedom of medical choice. Nor shall the President, Congress, state legislatures and executives, governmental agencies or departments make any law, rule, regulation, countermeasure, executive or emergency order that impedes the individual's right to medical privacy and freedom without individual and specific judicial warrant, supported by oath and affirmation of necessary cause to protect society from harm, describing the individual's condition and danger it presents. Medical freedom is the individual's absolute and inalienable right to autonomy over one's body regarding all medical treatment. Medical freedom requires enforcement in all medical practice from healthcare providers, physicians, public health officials, researchers, governmental bodies, manufacturers, and all others involved or have an impact on an individual's healthcare. Informed consent is the most important issue of the 21st century. It is the cornerstone of medical freedom and individual health. Informed consent is a legal and ethical concept that ensures the individual has the right to be fully informed about the risks, benefits, and alternatives of a medical intervention before making a decision. There is an overlap between medical choice and informed consent, emphasizing that informed decision-making is a key aspect of exercising medical choice. The most important aspect of the Medical Freedom Amendment is all people have the right to secure their health in the manner they choose. Medical privacy involves safeguarding an individual's personal health information from unauthorized disclosure. It is crucial for maintaining trust in the healthcare system and ensuring individuals can seek medical care without fear of unwarranted intrusion. Clayton J. Baker, MD, presented a definition of medical freedom on the Brownstone Institute website and a list of innumerable abuses to civil rights inflicted by the health establishment and physicians upon the individual. https Brownstone. Org articles. What is medical freedom exactly? He writes, in the wake of the COVID-19 catastrophe, and in light of the innumerable abuses and affronts to basic civil rights that the public health establishment and the physicians under them inflicted upon citizens, several derivative statements follow. Confidentiality is central to patient autonomy. Specifically, any health passport type of public health approach violates patient autonomy and must be forbidden. The patient-physician partnership. The patient, working one-on-one with their physician, must make clinical care decisions, with the patient reserving ultimate authority to decide. Clinical care decisions must not be predetermined by government bureaucrats, statistical analyses, industry influence, insurance carriers, or other outside influences. Non-maleficence refers to the first do no harm precept of medical practice. No medical treatment should be imposed on any patient that is likely to harm the patient or where the risk-benefit ratio is negative for that patient. Coercion of any kind applied to patients or healthcare providers violates patient autonomy. This includes bribery, incentivization, threats, blackmail, public shaming, scapegoating, exclusion or ostracization from society, deceptive advertising, and all other forms of coercion. Patient redress. Patients must have the right to seek real and meaningful redress for any kind of negligent or malicious harm done to them by any physicians, healthcare systems, public health officials, or producers of drugs or other healthcare products. No one involved in the healthcare enterprise may be immune, and laws providing such immunity must be removed. Actions and events are destroying medical freedom. One is the recent FDA rule denying informed consent. Another is the FDA's future framework. Informed consent requires the disclosure of all relevant information, ensuring understanding, capacity to comprehend, and alternatives that leads ultimately to the individual patient's agreement or refusal. The Food and Drug Administration, FDA, placed a rule in its administration effective January 23, 2024, that it will not follow informed consent. Certified Government Publishing Office 88228. The final rule permits an Institutional Review Board, IRB, to waive or alter certain informed consent elements or to waive the requirement to obtain informed consent. On April 6, 2022, the members of the FDA Expert Advisory Committee on Vaccine Safety, VRBPC, unanimously agreed that the COVID-19 shots weren't working, needed reformulation, boosting was not the answer, and that there was no protective benefit. Back in springtime 2022, the FDA began removing some of the VAERS reports. Also, the government allowed the FDA to adopt future framework, allowing reformulations of shots without clinical trials. No informed consent, no clinical trials. What has happened to the practice of medicine and logic? We are faced with dangerous, apathetic, and destructive public policies. Public health is extremely important. The Medical Freedom Amendment recognizes this importance and sees the urgency for public health to do its proper job. The number one most significant threat to public health is now wireless electromagnetic radiation pollution, followed closely by air pollution, including geoengineering, water pollution, and soil pollution. Public health's role is to identify the pollution, reduce and eliminate it. By protecting our environment, we can eliminate the causes of our chronic diseases. We do not need a war on cancer, we need a war on the causes of cancer. Government mandates replace sovereign rights with public health, casting a net of enslavement, forcing wrong medical action, even against our personal healthcare providers' advice. Medical Freedom Amendment, MFA, is supported by those who revere truth, critical scientific study, and oppose scientific censorship and government propaganda. Here is the problem. We are speeding towards the elimination of medical freedom by the World Health Organization, governmental agencies, and a Congress tied to corporate money for re-election. We must unite and act now to protect our health and sovereignty. The Medical Freedom Amendment provides that unity and strength. Join the National Health Federation, NHF, which endorses and supports the Medical Freedom Amendment. The NHF has a long tradition of promoting and defending health freedom, consumer and individual health protection, and its unique position of participation in the Codex Alimentarius process. The NHF Medical Freedom Amendment campaign, the NHF.com, the Medical Freedom Amendment has grown into a true demarcation between the government's right to prescribe and demand medical treatment and our individual inalienable right to control our medical and health decisions. This individual right is inalienable and absolute. The time is now. Participate in the Medical Freedom Amendment 28.